We need to go to questions now. I did want to say to Dr. Baase that I think there are many people here in the audience that are very interested in the corporate world and how we can stimulate more companies to understand the return on investment that Dow Chemical has developed in your plan. And so maybe there will be questions about that. But in any case, we do have a question.
What steps can those outside the academia and research corporate arenas take to assist in creating a healthy consciousness in our environments?
Well, just to give you a quick answer, I would say to look for those kind of community efforts that are in place. And, you know, these multi-stakeholder efforts are happening in a lot of communities. And there's the involvement of all stakeholders, including, you know, consumers, patients, citizens have roles. And I would just encourage people to seek out those kinds of opportunities, and if they don't exist yet, to see if you can stimulate those happening in your own community.
That's an outstanding question, because really I do believe all health is local, and our communities really have been working in many ways for a long time. And so we, as health professionals and as residents in our communities, you know, we need to look for those opportunities. There are so many opportunities for people to join in if you make information available, right? And certainly Healthy People 2020 is that data. The schools have been working on this, so families that are connected to their schools can find groups that are working on safe routes to school and healthy eating and active living. Churches, we talked already about, neighborhood coalitions, community action partnerships. These individuals have, I believe they've been immunized. They've been inoculated to look for how can they improve their own health and how can communities come together. Some communities is more difficult and there's more challenges, but as individuals, as local health professionals, we all can join a group, start a group, coalesce a group, and listen very carefully to where they want to move and make sure we're part of that action for better health.
Thank you. Are there other questions?
Yes, we have another one from Twitter.
A Twitter question.
Yes. The first one was also, I apologize. Will Healthy People 2020 focus on health literacy?
I'll take that.
Okay.
Because that's something that's near and dear to my heart. And we do have a health communications chapter in Healthy People, as most of you in this audience know. And health literacy is tremendously important. When we think about cultural competency, it is the tool to achieve cultural competency in dealing with American citizens across the board. The Office of Disease Prevention and Health Promotion led an effort that resulted in a national action plan for health literacy that was released earlier this year. I want to call your attention to that and hope that you will find that useful in your work to make health literacy an important part of improving the health of our nation.
We have one last question.
Hi, my name is Freddie Donner, and I am the co-chairperson of the Health and Wellness Committee of the Dulles Regional Chamber of Commerce. And we are one of those neighborhood entities that are very passionate about getting health and prevention communicated into the area businesses, which are generally 200 people or less. And we're just not really sure where to begin to tie in. How do we tie into this? So we could use some input, and I'm sure other chambers could too.
I think one of the things that's been helpful to us in the past in terms of getting business involved are two things. One is, in the past we had the big books, right, and they were really thick, and they were a bit overwhelming. So extracting that into a summary of those most relevant to the work site was very helpful, and Partnership for Prevention did that. And I think those were excellent summaries. So now it's on the website, but I think getting a summary of the most relevant objectives, culling through that is a very helpful way, because you're not going to get most businesses to read through all of the objectives. They don't have time. So making it simpler. The other thing is bringing in some of the economic case, the business case. And again, you can pull that up from some work that Partnership for Prevention has done, illustrating the most cost-effective actions and some of the things that are in the Guide to Community Health. Because one of the challenges people can see is, oh, I can see all these things to do. What actually do we do now? I mean, the Healthy People sets targets and areas to work, but people need a plan of implementation. And I would sort of knit together the action plan development with some of the things that are available from the Guide to Community Preventive Services. That is a really tremendously helpful resource in figuring out what things really do work. So it's make it simple, get a business case analysis that's helpful so people understand why they should invest in this space, and then 3, make sure you have some idea of what to do, not just what the description of the problem or the need is.
Dr. Engel.
In North Carolina, we've just begun an initiative called Work Well North Carolina, or Work Well NC, and it does address small business with 100 or few employers. But again, I'll have to emphasize the nature of cross-governmental importance of getting the word out. So our Secretary of Commerce, Keith Crisco, who was formerly a small business owner and very successful in a healthy work site, is leading that initiative. So I'm not leading it. It, again, is our Secretary of Commerce. But he gets it. He's a champion, and he knows the economic, why this makes sense, the business case. And so we're helping him as technical experts to provide that toolkit for small employers in North Carolina.
And reach out to your local health jurisdiction. If they're not a member of the Chamber of Commerce, you should invite them to become one. And really, it really is the more spontaneous development of your own action plan. And Cathy is right. I mean, it is an overwhelming task to look at all of these indicators. And also, it's a very personal experience to look at the data about your community and know what's the best place to start. So together with those individuals and some other local healthcare providers and the communities and the families from these businesses, you can develop an action plan, as Peggy said, that is based and relevant to what you all believe is the most important steps. Our health action, I mentioned the council, used the 2010-2020 tracker, as the framework or the roadmap, but we really developed a local kind of current document that is our web-based version, so that everyone feels very linked to that information, and it brings a group together and gives them purpose to move forward.
Another untapped resource is community colleges. They are looking to small and large businesses to find roles, and they clearly are a resource for public health. There's a new objective in Healthy People 2020 to encourage associate degrees and certificate programs, and this would be a perfect connection for business.
And if you haven't recognized this already, there are some provisions in the new health reform law that support small businesses from an economic perspective in getting some money to fund those programs. So that might be another assistance.
Wow, I think I need to make these people Healthy People ambassadors. They are ready and willing and very able to help, as have you been Healthy People ambassadors and willing, ready, and able to help. Many of you in this audience have participated in helping us develop the health goals for our nation for 2020, and I sincerely thank you. Today marks the launch of that initiative, and as Dr. Coe said earlier, now the real work begins. And we ask for your participation. We ask for you to join us as we move forward into the next decade to make this country a healthier nation. Thank you for coming today, and thank you for all you do. You all were wonderful. Thank you.
Ladies and gentlemen, this concludes our program.